diagnoses are categorized by the actual drug. So when you record this, rather than just saying sedative hypnotic dependence, as we used to do in DSM-4, you might say alprazolam use disorder or Xanax use disorder, and be more specific about what the drug is, or cocaine use disorder, not just stimulant use disorder. Now, a big one that has changed in terms of the criteria is dropping legal problems as one of the diagnostic criteria. And one of the reasons for this, well, several reasons for this, was that there was very low prevalence in adult and adolescent populations of that being an important criterion. Now, you may say, well, that doesn't sound right, especially if you're an addiction treatment program where 90% of your referrals are for mandated legal, from the legal system. But remember, the people who get into defined addiction treatment programs is that tiny sliver of people who have addiction problems. The great majority of people who meet diagnostic criteria don't necessarily have legal problems. Those who are just showing up at the doctor's office go there for their back pain when they have really an addiction problem. And so there was low discrimination between legal problems being a clear indicator of substance use disorder, because you can have legal problems if you have antisocial personality disorder. You could have legal problems if you're psychotic and you're a homeless person and you may be trespassing or using somebody's backyard as a toilet. You could get arrested for disorderly conduct. There's many legal problems that cut across other diagnoses, so it wasn't distinctly separate for substance use disorders. And then there was a poor fit for legal problems with the other diagnoses, and you didn't really lose anything if you took legal out in terms of missing people who had substance use disorders, because usually they had other criteria that would get them into a substance use diagnosis. The legal problem wasn't the one that sort of was the deal breaker. And so legal problems was taken out and replaced with craving, which had much more backing when you look at imaging, brain imaging, pharmacological treatments, when you look at genetic aspects. Clinically, all of us who work in addictions see the importance of cravings. It made much more clinical sense and fit with other diagnoses.